Actually, sexual problems are some of the most common problems that survivors describe, both during and after cancer treatment. It is also, sexual problems are often some of the most distressing issues that people face. We see some problems that are very much related to changes that are happening during treatment, whether that's in part because people are ill from chemotherapy or fatigued or having very specific side effects from the treatment. And some sexual problems are what we call late effects or long-term side effects that stay with people long after treatment is over. There are a range of those, and they may be anything from erectile dysfunction for men to changes in desire, libido, pain or discomfort for women. But there are certain problems which are actually quite common across different diseases and different treatments, which we know are problematic for both male and female cancer survivors. The range of treatments that we bring to bear in order to manage and hopefully cure cancer all have the potential to disrupt sexuality. So what we mean by that is if you look treatment by treatment, whether that's radiation, chemotherapy, surgery, or hormonal therapy, they all have potential to do disruption to the sort of the physical body. So for example, after breast cancer treatment, women go through surgery, often mastectomy, one side or both sides, which has, as you can imagine, an understandable impact on body image, on physical sensation, on the experience of femininity and identity. That's sort of obvious. Sometimes the changes are not as obvious. So for example, women who go through reconstruction might get lots of feedback that they look great, but they still lose complete breast sensation. And that's something that is less obvious, change in sensation, for example. But when a part of your body that's used to being sort of an essential part of your body in terms of sexual function is sort of taken out of play, that has a big impact. So sometimes there are physical changes like that. For men, we see erectile dysfunction, commonly related to either chemotherapy, radiation, or hormonal therapy for a range of cancers, whether that's, for example, prostate cancer, colorectal cancer, bladder cancer. Sometimes the changes may be emotional changes. When a man or a woman has an experience in which he or she doesn't feel like they're able to have the same role that they used to. For example, there might be a man or a woman in which in their relationship life they're used to initiating sexual contact with the partner, or they're used to taking the lead. And if he or she doesn't feel whole, or he or she doesn't feel comfortable in their body, it's hard to do that. And that can shift a whole dynamic in relating and in partner function and communication, which has impact, as you could imagine, on sexual function. Sometimes the changes are very mechanical. Sometimes we're not, women may go through menopause or go through chemotherapy-induced menopause. That's very common, especially for women who have chemotherapy before the age of natural menopause. And women have very significant changes in vaginal function. When you go through menopause at a young age, and you might not know about how to take care of vaginal health, you're left with something akin to vaginal dryness, which means that sex can hurt, and that if you don't take care of that, it doesn't get better by itself over time. That's a very common problem that does not get discussed adequately, and lots of women often give up because if sex is uncomfortable, if sex hurts, and partners certainly don't want to hurt each other, people often feel that that's the price they have to pay because they went through cancer treatment and don't get the help they need. So there are a range of problems that are often more common than others, but often don't get talked about, and people often don't know that there are answers and that there's help available. First and foremost, I think it's really important to identify where the problem is, because lots of times people themselves aren't sure. So when we think about sex, again, thinking about that really at that intersection between physical and emotional and relationship, there are many different places where sex can get disrupted one way or another. So for example, if a woman finds that she has, quote, low libido, and she can't really sort of see any way around that, but what's really going on is that she started to try to have sex after she had cancer treatment, and it was really painful and it was uncomfortable, and at a certain point she just didn't want to do that anymore, and her partner absolutely didn't want to sort of hurt her. Then sort of there was a way in which sexuality mutually became something that was really to stay away from. Well, funny thing, if you have sex and it hurts after a while, you're going to have a libido problem. So, for example, we need to figure out the mechanical piece. We need to figure out how to help that woman sort of restore vaginal health. We need to sort of help her take care of her body and find a way to be able to have sex comfortably. And then we can sort of think about how to help her kind of get her interest and desire back online. You know, in order to be able to talk about desire before we sort of figure out the mechanical piece, it wouldn't make a lot of sense. So often we really just have to do a very careful survey about what's going on in order to figure out where to sort of start the intervention. Similarly, it's very important not to take too narrow a view. You know, sometimes it's really important to help people sort of understand that, yes, the mechanics are important, but it's just as important to be able to figure out how to communicate with your partner in a way that you haven't done before. You know, sometimes when you're young and everything's working just fine, you don't ever have to talk about sex, and that's fine. It's sort of, things work well enough. But when things get disrupted and things are different, we need to be able to communicate about it. We need to be able to help couples work as a team in order sort of to have sexual but sensual experiences, pleasurable experiences, as sort of step-by-step way to getting back to intimacy. That's not all or nothing. That's a good example, you know, that we live in a culture in which it's all or nothing around sex often. We see that at the movies, we see that in billboards, and that's not really how it works for real people in real life. When we go through a traumatic experience, for example, after a cancer treatment with sexuality, you know, couples need to work slowly, 1 foot at a time, putting a toe in the water, rediscovering what is pleasurable, rediscovering what feels good, without feeling that it has to be all or nothing. And that's a process more than something that happens like a light switch. Don't be afraid to bring it up. I would say the most important thing is that even if you know that your healthcare providers or healthcare team haven't asked you, how's your sex life, it doesn't mean that it's not important, and it doesn't mean that it can't be fixed if it's broken. You know, I think the number one issue that people often say or think is that if nobody's asking about it, the assumption is that nothing can be done. And that is a misunderstanding, right? That is a misperception. What it means is that doctors and nurses don't get a lot of training about this, and they themselves might not be sure what to say. But it just means that you have to find the right resource. It just means that you have to find the right website or find the right support group or find the right therapist. But most of the problems that we see are problems that we absolutely can address, and that it's so important for people not to give up hope, for them to feel like this is the price they have to pay for going through cancer treatment, because it's absolutely something that we can do something about.